Why is healthcare such a big issue ahead of the UK election? Well, the National Health Service, or NHS, is missing many of its targets. NHS England tracks how many patients wait more than 12 hours for a hospital bed. There were less than 500 of these cases in the whole of 2014. But in a single month, January this year, there were nearly 55,000. Patients are also waiting longer in the accident and emergency department. NHS England says 95% of patients must be treated, admitted to hospital or transferred within 4 hours. But at the start of the year, it achieved that goal just 55% of the time. Meanwhile, there are problems with ambulances. They're supposed to take less than 18 minutes to reach a patient in a serious condition. For example, someone who suffered a stroke. But just a few months ago, the average response time in that situation was nearly 35 minutes. The British government is set to spend almost $230 billion on health and social care this year. That's more than the combined budgets for education and defence. The government says strikes by workers have made things worse. But opponents say the UK has failed to invest properly in the sector for over a decade. British society is also getting older, with half the population now above the age of 40. More elderly people means more demand for healthcare. The country's leaders, whoever they may be, will have to find ways to deal with those challenges. Because nobody votes for bad health.